Good day to you, Guyana, and welcome to Facing the Nation. I am Malika Ramsey. Thank you very much for joining us this week. This week, a Partnership for National Unity is concerned that the current government is not doing enough to protect the population from vector-borne diseases. And of course, this topic comes as citizens seem to be worried and concerned. Of course, not only you at home, but I myself am a bit concerned about the current disease, chikungunya. It's not a new disease, but it's new to Guyana. We don't hear about that as we would hear about dengue and filaria and other vector-borne diseases. So we're currently worried, in a state of some of us are even in a state of panic. The minute we sneeze, we wonder if we have chikungunya. But today on the panel, I have the two doctors with me, APNU's two prominent doctors, Dr. Karen Cummings, Member of Parliament, and of course Dr. George Norton. None of them, they're no strangers to you. Dr. Norton, as you know, is the Shadow Minister of Health. Welcome back, ladies and gentlemen.
Thank you very much.
All right, great to have you. So first off, my first question to you, Dr. Norton. In that clip, we heard you saying that you hope that the authorities don't wait until the disease penetrates Georgetown before the fogging exercise starts. We know that fogging exercise has now begun in Georgetown. Is that what happened, Dr. Norton? Did they wait until we start hearing that the disease may be in Georgetown before the fogging began?
Well, there's no doubt about the fact that we had a patient from the West Rhineland area.
Mm-hmm.
And in spite of the fact that we're trying to give the impression that it was imported from Berbice,
Mm-hmm.
I'm certain that that patient being in Georgetown with the virus was not in any way prevented from coming into contact with mosquitoes, because mosquito is a part of life in Georgetown. While I agree that we might all be exposed to mosquito nets, yet that is a particular time and position of your, let's say, of your daily life. You only get the use of the mosquito nets when you're about to sleep, when you're on your bed.
Yeah.
So you're gonna put the whole house on the mosquito net. That's the only way, that can prevent you, like, on a 24/7 basis. But we know we had that case of that 28-year-old patient in West Rhineland with the chikungunya virus. I'm happy about is the fact that we saw at least a schedule. We saw a roster of where fogging is going to be taking place and how it's going to be done and when, because that is so important. We don't know, different persons react differently to the fogging exercise, and we can very well be creating a problem by itself if we do not inform patient when we're going to do it, the effects of what this will have, and how it can be prevented. But to answer your question, it turns out to be such a situation that we probably waited until it's here in Georgetown before we start fogging.
Before I come to Dr. Cummings, is fogging, because we're only now hearing again about fogging maybe after several years, now that we hear about this chikungunya outbreak. Is it that expensive for the Ministry of Health and the various health departments to carry out this fogging exercise at certain intervals during the year? Do we have to wait until there's a breakout of some sort before we have this? Can't it be ongoing?
The track record of the PVPC government is one which speaks in that favor. Everything is happening as a knee-jerk reaction. Not only are we waiting for the crisis to practically be in a particular area before we start fogging, but we're waiting for persons to fall sick. Here it is, and this is the example that is worrying. Here it is that we know that we have the equipment, we have the machine in institutions in Georgetown for testing for this chikungunya virus. Why it's not being done? Why we have to send hundreds of samples to Trinidad? Because we have no person trained to do the testing. So what are we doing now? Trying to get persons training, trying to do it. What are we waiting for? Is that what the ministry, is that the policy of the ministry, of just waiting for something to happen before we act. We've got to be more proactive rather than being reactive. And this has been happening all the time.
Is it that and eventually I'd like Dr. Cummins to jump in on this too, because I know in her clinic she probably experiences this. Is in terms of identifying chikungunya, and then there's dengue fever and filaria, is the process so technically different that, because as far as I know, you can correct me if I'm wrong, we don't have to send overseas for us to find out if somebody has dengue or if they have filaria, but is it that technical that we have to send overseas?
Well, it can't be that technical if it's being transmitted by the same mosquito. It's the same Aedes aegyptis. The symptoms are practically the same. I mean, and it's there in the same environment. It can't be all, and most of all, we have the equipment. So, and then all we're hearing now is that we're going to bring persons into the country to train people to test them here in Guyana. What are we waiting for? For the chikungunya to take over all of Georgetown, but not only infecting them, but killing persons?
And I'm assuming when we send tests outside, we have to pay for these things to be done.
We certainly have to, but look at the time. Look at the time, because remember, we're dealing with human beings. And if a person is going to sit in the public hospital or any health clinic to wait an hours before they can get the results of a disease so that they can get treatment to relieve them of the symptoms, they're going to do the other alternative. They're going to treat themselves or to medicate, because if you have a flu symptom, then there's so many medications that you can use to get rid of that flu, because what you have is symptomatic treatment. And if you're feeling pains, then you can take an analgesics. If you're feeling fever, then you take an antipyretic. If you're feeling like nauseated, you want to vomit, then you take something to help that.
And is it dangerous to use whatever medication you would usually use if you have a regular flu? If you use that same medication on this chikungunya virus or any other vector-borne disease, is it dangerous to do that?
It certainly is, and then it's not in the best interest of the country, because what we need to have is control. We need data. We need persons who are sufficiently informed as to how to treat and what to look for. And we also need to educate the public of what to do.
Okay, all right. At this point in time, viewers, I must tell you, I'll open up the phone lines a bit earlier today. We're only dealing with vector-borne diseases and any other matter in the health sector because I have the two doctors. So just let's stick to the health sector and, of course, vector-borne diseases. Now, Dr. Cummins, in terms of your work, in terms of your clinic, what you've seen thus far, should we be worried? Should Guyana be worried about this? Before we go on to the other vector-borne diseases, should Guyana be worried about this chikungunya disease or virus caused by vectors?
Yes, it's a cause for concern. And just to echo the sentiments of Dr. Norton, we have to stop being reactive. We have to have some kind of, I think sometimes I get sometimes I feel that persons are short-sighted, You've heard it's in the Caribbean. You won't wait for it to come to your country before you do something about it. Dr. Norton spoke about the fogging exercise. Of course, we congratulate them for fumigating and fogging. But then you must have some kind of schedule. It must be ongoing because of our climate, we're too wet, too dry, we're low coastal plain, So all these things we take into consideration. In terms of our agriculture practices, we need to consider those things. And so we are definitely at risk of the coastland. And what I noticed of the incident, the guy that was, the 28-year-old that was diagnosed and identified in Western Veldt, no one had done a mapping to see how this is going. We heard it in Berbice, now it's region 4. Where else? Anybody's tracking to see where it's coming from, where it's going. So we need to be a little more proactive. I would say definitely to answer your question, it's on the increase. I've seen some more cases. We just want to make sure we want to the test to confirm the test and to verify definitely if it is.
Okay.
But I've seen from the clinical setting that we have some cases.
What's the process? Because I want to connect the dots here, because earlier Dr. Norton talked about when we suspect these things and we're sending samples overseas to be tested and all of that. If someone comes to your clinic, comes to you and you suspect that they may have that, they show all the signs, what's the process and the procedure, and how long does it take? Because all the time we have, like Dr. Norton said, we have a person who's sitting here ill, feeling ill, and they may want to take medication.
That's a good question. I saw a few patients this week, and I had to use my initiative and tell them, okay, I'm going to do what we can do, give you some stat treatment, and go and send them to the vector control department. But there's no kind of
send it the stats or the patients.
Well, in the first case, I took out samples from the patient. But afterwards, I recognized that these are some of the symptoms. They have fever, they have myalgia, arthralgia, they have muscle pain, joint pains, they have this rash. One of them had a generalized rash, and so I suspected, and so okay, I'm going to send you to the vector control, and they take it from there.
Apart coming off of checking, but then when you send that sample to vector control, how long does it take for them to get back to you?
I am not sure. You have to be proactive. You have to be asking. It's not something that the feedback is. We have problem with having feedbacks from some of these places.
Does it work that way with only because we have this prevalence of chikungunya, or the other vector-borne diseases like dengue and filaria and so on?
No, we just make sure the patients, some of them be chronic, like filaria, they may come to the clinic, so they have a schedule, and so you can follow them up. But definitely feedback from the national level to like the health centers, it's not so forthcoming.
Dr. Norton, do you believe that apart from chikungunya, because really and truly the fact is, and Dr. Cummins just said it, sometimes we need to be proactive. We sit and we wait for things to happen before we take action. And so the fact is, if there wasn't this prevalence, this sudden occurrence of the sudden emergence of chikungunya, we would not have been so hyped about these vector-borne diseases. So Dr. Norton, apart from the chikungunya, do you find that these vector-borne diseases are on the increase? Is it that we have a hard time getting rid of them? What's your findings?
We certainly have a hard time getting rid of them. I mean, take dengue, for instance. There was a definite increase in the prevalence of dengue in our country at one time. And here again, it's the situation of a mosquito-borne disease. Where the mosquito lives, their life cycle, how they're able to transmit. Okay, it's easy here in the coastal area, and particularly in places like Georgetown, where we have a problem with sanitation. Okay, I say Georgetown because of the density of population, but we've got a sanitary problem all over this country, and an increase in the vector disease, the vector would always be something for us to worry about. But it's not only dengue, so it's malaria. We all, the good thing about the gold rush was that gold was carrying a high price in terms of money, but it was also taking a toll on the lives of the Guyanese persons who were mining gold. Because if you know the conditions under which those people work, the distance that they work from the nearest healthcare giver, the ability of the healthcare giver to administer the correct medication to these persons, you will find that we are, up against a wall, because not only would they be taking the wrong medication, but that they would be exposing themselves to creating, let's say, the resistance of these diseases to a medication that might have been helpful if used correctly. And we have to worry about that. You find a disease like dengue is directly related to climate change and global warming. Okay? So we have a problem that might not only be, let's say, localized in Guyana, but we can get it under control if our mining practices are, let's say, regulated to avoid the kind of stagnant pools of water that is left in minute areas. It would be amazing for one to fly in an airplane over the Madhya area and see what is happening to our forests there, and in areas like Region 8, and you can only imagine what will take place there. The distance there away from where they can have easy access to medication should they be contacted is so far that many a times persons prefer not to seek the treatment. Okay? And then again we have the other case of the Culex mosquito, which transmit the filaria. For us to be able to control filaria, what the ministry is doing now is trying to do a massive drug administration. That is, try to give the medication, the treatment for filaria to everybody to see if we can get it under control. There again, it's the same mosquito with the water, and so we have a problem. We have a problem with dengue, we have a problem with filaria, we have a problem with malaria, and now the chikungunya is going to be here, coming into fertile territory where their cousins, so to speak, or even their brothers would have been surviving for years.
This might be a kind of a difficult question, but this chikungunya disease, do you get the sense that it may just be a temporary thing, or will it stay around like the malaria and the dengue and the filaria? Do you think that we can actually get the complete rid of it?
Well, when you take into consideration that it's that Aedes aegypti, Egyptine mosquito, that is responsible for the transmission, it is not so much the virus, it's the mosquito that you have to think about. Okay? And if dengue has been around for such a long time because of that mosquito, and we couldn't get rid of and we can't get rid of dengue, there's no way we're going to get rid of chikungunya. And chikungunya really and truly has been around for some time now, since in 1959, I think they discovered it elsewhere. It's reaching here. But we know it was coming. We know it was coming. We know it was there in French Guyana. We know it was in the French islands in the Caribbean. We know people were dying from it. And then we're getting the news from the authorities that, we have it all under control and we don't want the people to know because we don't want the tourism to be affected and things like that.
No, but Dr. Norton, I must jump in here. You said that we know people are dying from it. I mean, the last report, I'm probably late on this, but the last report I've read coming out of the media is that this disease is not a deadly disease. It wouldn't kill you. It's like a flu. It has to run its course. Did I misinterpret?
Persons have died from it. Okay? Now, if you probably look on the death certificate, you might not see death due to, let's say, the chikungunya disease virus. But when you take into consideration that it affects, we've got some disease lurking out there, waiting on on your immune system to be compromised. And this is certainly compromising your immune system, where you become weak, where you're lost of appetite, where you're suffering from fever. Any disease or any sickness that you might have had that you could have resisted before would now become aggressive enough to kill you. So it's contributing to your death. Nobody dies from HIV, Nobody dies from HIV. They die as a complication of of having it.
All right. Very scary indeed. Let's talk about awareness now. And of course, eventually I'd like Dr. Cummins to jump in on this, where the people in Georgia are concerned. But for you, Dr. Norton, you talked about a whole lot, and it's a lot to take in about the mining areas and the fact that you'll find these mosquitoes prevalent in those areas. Do you find that the people of themselves, and this is even before I go to government and the Ministry of Health, do you find that the people of themselves in those communities are fully aware, or do we need to have public awareness in those communities? Well, look, your area is probably compromised. You need to do more to protect yourself from contracting a vector-borne disease.
Now, when you refer to people in these areas, and this is important for the whole Guyanese community to understand, the persons who would be working in, let's say, in Madhya, are not from Madhya. They're from Ants Grove. They're from Mahaika. They're from Clonbrook. They're from the East Coast. Okay? They just go there to make a money and to get back down. If you're talking about the persons, the Amerindians who are living there, yes, then you have a serious problem there where they would want the miners not to be there, not to mine in such a way that they can leave part of a running creek stagnant and so on. We have a big problem there, and they are protesting, but protesting without having their problems resolved. We have a serious problem there. You go and you see an area that was finished mining and is left just like that, and we hear about reforestation and
there are things that can be done to protect those, because you just said there are areas that there's mining and so it's done and then it's left like that. There are things that can be done to.
Well, you should try to at least replant that which you destroyed and cover the areas that you left, let's say, cavities in. But nobody's there to monitor it. Nobody is there to make certain that that is being done. And we were very, very far away from that. I have seen where miners mine through the road that they used to go to the mining camps in order to get gold. In other words, they travel on this street. It's like boring the bridge that you just crossed because you found gold.
And you may have to cross it again.
But you have to. Okay, that is the mentality of this, the persons that you're dealing with there. And unless we can get it under control, malaria might be, let's say, least in the mind of the persons who are there looking for gold.
Okay, all right. Dr. Cummins, this is apart from fogging that the fogging exercise government has recently taken on. Do you find that here in Georgetown, that you and I, the regular person, the person who's watching, the child, the mother, the grandmother's watching, do you find that we're aware enough, we're alert enough when it comes to trying to protect ourselves from vector-borne disease? Because Dr. Norton talked about the net, the mosquito nets. You can't walk around in the day with mosquito nets. And then I heard an advisory too where they're saying during the day try to wear long sleeve. How practical is that? We live in a very hot country. So are we aware in Georgetown here, are we aware of the dangers and what we should be doing to protect ourselves?
No, I think more needs to be done in terms of IEC, information, education and communication and the materials. And so they have to be a little more strategic, maybe at the school levels, at community levels, maybe at your workplaces. We need to have some flyers, brochures, telling you about the disease, how to treat, how to prevent, the mode of transmission, and so forth. But all in all, it's here with us, and we have to step up our surveillance. We have to, in addition to the fogging, we definitely have to keep our yards clean. I recall when I was younger, long ago, you had these public health inspectors would come in your yard. They had on a brown khaki, that was a uniform, and they would check the latrines and the the septic tanks and so forth, and sprays and so on. So there's breakdown in the public health structure, and so we need to go back to where we were before in terms of being strategic in terms of public health practices, and of course the people be taking care of the environment. There's a breakdown in how we take care of our environment. So the foam boxes and the drains not clean, we finish cleaning and it's gone back, and so it's a lot of work to be done. It's doable, but I think we have to keep educating through the media, the television. Some of these commercials, we'll have to tailor it to suit more public health messages. Okay. So I think we'll have to definitely step it up. The government will have to scale up their...
Dr. Norton, while we're waiting on the phone lines, now, the health system, and of course, viewers, I'm just being realistic here, I'm not trying to be negative, but if there is a major problem, really gets to a really bad state, catastrophe, in terms of vector-borne diseases, not only chikungunya but generally, is our public health system strong enough to handle it? More so the Georgetown Hospital.
Without a crisis, without any epidemic where you have patients who has to be hospitalized, we have a problem at the Georgetown Public Hospital. With the shortage of beds and the shortage of materials and consumables and everything, we can't take more than we have there now. Anything more than that is bursting at the seams, overflowing. We certainly would be in a big problem, a large problem here in this, in this city, because we have basic medications as I said, for vomiting, for fever, for pain, that many times you can't get at the Georgetown Hospital under normal condition, much as when there is a virus, when there's an epidemic of a virus inside.
Okay.
And don't forget, we're now gone into a rainy season, and this rainy season can very well be a long rainy season. Think of I'm hearing now about the efforts that they're going to make at the Larabin Cemetery. But you just look at where that area is situated. That's a forest.
Yeah.
And you can just imagine about the millions of populations of mosquitoes that are there. And so we're in big problem. We're in real problem. And we're going to get that vector-borne disease problem here with us for the longest while. And so what are we going to do? Keep people home? I mean, like the QLEX in the case of filaria, they strike between 7 and 7 o'clock, 12 p.m.
What
to
is
12
actual
p.m.
time?
Yeah.
Okay.
Are you going to what? Stop the country from activities from that time? You can't go along that line, okay? And how much it takes? It just takes that. Just one single, you don't have to be like the African bees be stung by so many before you become infected. It's just one. And that's it, and then from that one to the other. And as I said before, people don't know, but persons came to Guyana, was bitten by mosquito, came back a year later, and the scars of those mosquitoes were still there on their skin, And it is something that we have learned to live with here in Guyana, but it can be, some danger just lurking there for us all the time.
Dr. Norton, before I come to Dr. Cummins and we have to close, in just about 30 seconds, because it always comes back to what, and if I may use this U.S. quote, I can't remember who exactly said it, but ask not what your country can do for you, but what you can do for your country. What can APNU do specifically to this in terms of vector-borne diseases? We've talked about the problem, but what you, more so since you're the main health representative, what can you do to help the society in terms of these vector-borne diseases?
I am a member of parliament. I'm a politician in the APNU camp. One of our duty here is to inform the population of the status in which we exist, and that I will never refuse to do.
Okay.
I would certainly encourage them to do the positive things to help themselves. Like you did say to some of the persons who call in, that it's time the community probably do not wait on the authorities to do things, and they should do it for themselves. I have grown through a period where the so-called self-help was a part of our culture, where we used to go and come out in cleansing force, for all who might remember who Burnham was, and we used to do things before. We might certainly have to resolve to that same situation if this regime remains in power with the attitude that they're having towards the environment that we have, and to ignore all the rhetoric that they're using, and the propaganda that they're doing it in the best way that the way it's supposed to be done, because that's what they're saying. When you listen to some of the ministers, particularly the Minister of Health in Parliament, you'd want to know if you're living in Guyana. You'd want to know if this is the country that you're living in, when you go and after waiting for hours at the Georgetown Hospital, you can't get an ECG done in the accident and emergency department, and you hear of so many things that are being done, of specialty hospitals that has promised to the nation. The main referral center that you have don't have those equipment available right there.
All right. Thank you, Dr. Norton. 30 seconds, Dr. Cummins. What do you want to see immediately done to address the issue of vector-borne diseases?
Okay, Melissa, first of all, I just want to reiterate the point that development must include the welfare of the people. I mean, you must prioritize. I mean, these buildings that's going up, the Marriott Hotel is good in itself, but at this point in time, our priority must be development of our people.
Okay.
Here we're having a crisis. tools and resources must be tailored to suit and to address this concern. So at this point in time, I would like to see more awareness program being done in the television and different media, in the schools. I would like to, at the local government level, at the community level, for them to have a system where they'll clean up their communities, the stagnant waters, to get rid of the stagnant waters, these waters in tires and so forth, just clean up our environment. So I trust that we will able to, the patients and the persons in the community will go to the clinic, the health centers, because each one of these system is designed in such a way that most of these areas you have a health center. So at that micro level and the meso level, we ensure that they will make use of these health centers so they can be informed and able to take care of themselves in a better way.
Thank you very much. Thank you to both doctors, Dr. Karen Cummings and, of course, Dr. George Norton, both APNU members of Parliament, and, of course, Dr. Norton is the Shadow Minister of Health in a Partnership for National Unity in the National Assembly. This has been another program of Facing the Nation. Thank you very much to our viewers, and thank you to our callers, those who got through, those who did not get through, and those who want to hear us talk about going to various sectors. You know, we do that every single week. We bring you a different sector depending on what's current and what's happening in our society. I'm Malika Ramsey. Once again, thanks for watching. Join me again next time. Be good Guyanese citizens and take care of yourselves and each other. Goodbye.